Welcome back to Life and Living. Life overload. My next guest says that it's real and it's happening to a lot of us, especially to us moms, which I know I can relate to. She's Dr. Diane Schwartz, an internist at Englewood Hospital and Medical Center. Welcome to the program.
Thank you for having me.
For those who don't understand, explain what an internist is.
We do a residency in internal medicine, which essentially is all of the internal body organs that we have that function to keep us healthy.
So what kind of patients are you seeing?
We see primary care patients from adolescence through adulthood.
More and more, we're seeing this trend that people are not, and we're trying to reverse it, right? And those in the medical community are trying to address it, but that more and more people are not seeing a primary care physician. Why is it important that someone have that yearly checkup, that annual checkup, that it shouldn't stop when you reach adulthood?
We see that we bring our children to the pediatrician to a certain age, and then it tends to drop off. We pick it up again at menopause and after, when we think we're at risk for diseases. Unfortunately, women from childbearing age to menopausal age tend to use their gynecologist, obstetrician gynecologist, as their primary care physician, and that can be a problem.
Why is that a problem, especially in the context of how we started this segment with this whole life overload concept that we're going to get into in just a minute?
Well, women's health, unfortunately, for the patient who's not using a primary care physician, is more than just our reproductive organs. We have many other health issues that can come up, and we need to address them as they arise.
Let's talk specifically about women for a minute, about the stress that life is putting on many of us. And it's not just moms, and it's also, to be fair, not just women. It is men as well. But when we talk about women, we talk about stress and life overload and all the responsibilities that so many of us are juggling. How do we see that impact our health, both mental, physical, emotional, all of it?
Well, I think the big problem is partially that this society itself puts extra pressures on us, but we put the pressure on ourselves. We expect to be fantastic at all the things that we do. We want to have a job and be great at it. We want to be the best moms we can be and have these fantastic birthday parties for our children. I'm guilty of that. I had to have the most amazing birthday parties when my children were little, bake my own cakes that were that had to do with the theme of the party.
Right.
It had to be amazing. It had to make all the children go, ooh and ah.
So are we chronic overachievers? Is that the problem
Exactly.
here?
We can't possibly clean our own homes, be at the gym and be in perfect shape, go to work, take care of our children to the degree that we think we put unrealistic expectations on ourselves. And when we can't live up to that, we wind up with this ridiculous amount of anxiety and stress. And then we have this, I call it life overload. We're stressed, we're anxious, we're almost clinically depressed because we're not living up to these ideals that are impossible to achieve.
How do you address this with your patients? What advice do you give to the women and the men who are watching today who say, yeah, I relate, that's me, I do this to myself? And even if they're not feeling depressed, what advice do you have for them?
I try to tell them that this is very normal. A lot of women are feeling it. A lot of women are putting these same pressures and constraints upon themselves, and they have to, something has to give, and they have to either decide their house can't be perfect, they can't have a magazine ad for, your house is not a showroom, they maybe can delegate some of the different duties to their husband. They maybe can hire someone to do something else, get a mother's helper, something that takes some of the pressure off themselves. And that doesn't mean that they're a failure if they can't do that, because there aren't enough hours in the day to do everything and do everything perfectly. It just isn't possible.
This goes beyond medical advice, right, to just really practical advice for how we need to better manage our lives, better manage our stress. I want to get into some specifics. How do we know stress impacts the body? What are some of the physical ailments that we see as a result of that stress?
One of the big ones is high blood pressure, hypertension. If somebody has a family history or a genetic predisposition, this can be brought out by being stressed all the time. Also could be clinical depression or anxiety, panic disorder, obsessive compulsive disorder, brought to a level with which it will need to be treated with medication.
When you see your patients, are they usually very forthcoming about these struggles? Do you have to pry it out of them? Because I know we as women, especially the ones who want to do it all, these chronic overachievers, as we say, don't always acknowledge that we're in these stages of life, that we're feeling the way you're describing.
Some of them, I have to extract it, but for the most part, it comes out pretty easily. I think they're looking for somebody to unload upon and cry, and I always have to have my tissue box pretty close to me. And I didn't go into psychology or psychiatry, but I feel like that's a very big part of primary care practice, and I don't know if a lot of other primary care physicians feel the same way. My first couple of years of practice, I thought, I'm doing something wrong. Everybody cries when they come to see me, but I think it's because maybe I'm easy to talk to, and I guess that's a good thing because somebody has to listen and be able to help these people.
And be able to direct them if they need to see a specialist, if they need to go get some additional help.
Exactly.
And that's the role of the primary care physician, right?
Exactly.
Be that quarterback of that team, essentially.
And then there are conditions that can make these symptoms actually much worse. Thyroid disease, for one, if the thyroid is sluggish, you can have this be very magnified. Depression, anxiety can be magnified.
Exhaustion.
Exhaustion. So we need to look into that and make sure that that isn't adding to the problem at hand.
And in just the very few seconds that we have left, what advice do you give to moms, young moms, older moms?
Don't ignore your health. Have your primary care physician as well as your gynecologist. Your gynecologist will take care of your reproductive health, and then your primary care physician can take care of the rest of your body.
Dr. Diane Schwartz, Englewood Hospital and Medical Center, thank you so much.
Thank you so much.
How do you create change? By cultivating hope. And we see that every day. In the eyes of our preschoolers, in the souls of the seniors in our Adult Day program, in the minds of the students at Robert Treat Academy, a national Blue Ribbon School of Excellence, in the passion of children in our Youth Leadership Development Program, in our commitment to connections at the Center for Autism, and in the heart of our community, the North Ward Center, creating opportunities for equity, education, and growth.
Also brought to you by Berkeley College and by RWJ Barnabas Health.